Hi, in this video we'd like to discuss why you are experiencing repeated IVF failures. So it's becoming an increasing trend that most couples who are unable to conceive or having miscarriage, a lot of them will go directly to IVF now. It is all the rage nowadays, despite its uh, expensive prices. Many couples are willing to spend the time and also the resources to go for IVF to secure a healthy pregnancy. Now, the number one factor that a lot of patients experience failure with IVF, especially repeated one. Today, I'd like to talk about one of the most common factors, which is Hydrosalpinx. So, if you do not have Hydrosalpinx treated before going for IVF, your IVF very likely will end in a failure. And Hydrosalpinx can vary depending on severity. That's why if it's undiagnosed, sometimes it may evade diagnosis. If you do go for IVF, it's a high chance that your IVF will be a failure. So to avoid wasting time and resources, you need to treat Hydrosalpinx first before you go for IVF. So Antai Hospital treats Hydrosalpinx with a full contractual treatment. So Hydrosalpinx is a condition where your fallopian tube is swelling and accumulating specific fluids. So it's very distinct when we look at severe cases, but for those that are slightly mild or not so severe, moderately severe, it may or may not be very obvious. So you do need some experience and a trained eye, someone with a lot of experience to actually diagnose it properly. So when it's swollen like that, it's filled with fluid that can actually backflow into the uterine cavity. So when IVF is proceeding, is in progress, when the doctors put the fertilized embryo back into the endometrium for implantation to take place, for the pregnancy to develop, the fluid that's in the Hydrosalpinx fallopian tube, the one that is affected, this can flow back into the uterine cavity, and this fluid is especially toxic to the embryo. So it can destabilize, disintegrate the embryo very, very quickly. It can even affect implantation. It can even affect the endometrium's function. So it will most likely end in an inevitable miscarriage that is extremely early. So if you do not have your Hydrosalpinx treated, this thing happens over and over again, repeatedly, and you end up developing an immunological factor as well, complicating your miscarriage condition. So Antai Hospital offers a treatment for Hydrosalpinx where we do it differently than conventional treatment. Conventional treatment is that they will simply have it removed completely, the entire fallopian tube. They will actually surgically incise it. So at this point, you only have one fallopian tube left, which means your fertility rate is 50% only. And if you do go for IVF, another complication happens, you may end up losing the other one as well. But here at the hospital, we not only preserve your fallopian tube, we also retain its function, which means we can treat your Hydrosalpinx, empty the fluid, and also have it function normally. So what we do here is that once we empty the fluid, we only need to fold the top layer of the fimbria, which is the opening of the fallopian tube, and stitch it so that it doesn't close again. The main reason why Hydrosalpinx happens is because of the closure, permanent closure of the fimbria, causing the accumulation of these fluids. So our treatment here is very specialized. We use 3D laparoscopy, and we aim to preserve your organs and also preserve its function. And without any organ removal, you can have pregnancy achieved. With this treatment done, you may also have a healthy natural pregnancy. You don't longer need to go for IVF anymore because the fallopian tube is no longer blocked. There's no fluid accumulation. Fertilization can occur and it can still travel into the endometrium, so you can save a lot of costs in IVF and also save a lot of time there. So get in touch with us via the website if you'd like to find out more about Hydrosalpinx and other factors that can affect your IVF. Get in touch with us and let's see how we can help you today.